Hey guys, Aaron here with NPC Alternative TV, giving you the safest and fastest tips to alternative medicine using manual therapy. But before we start, please subscribe, please like. The more you like my videos, the more content I can make for you and for all of you, and we can have fun learning. But today, we're going to be talking about something extremely important. And I know what you're thinking. You're always saying, okay, when I see your videos, you're always saying the same thing. We're going to talk about something very important. But today we're going to be talking about something extremely mega 1000 explosively important. And that is we're now entering the world of clinical orthopedic neuromuscular findings. In other words, orthopedic testing. Okay. Now, before we start, I want you to know something. There's so many tests out there with, the names are a lot. There's Apley's, there's Babinski's, there's Yeoman's, there's Hibbs. There's a lot of orthopedic testing. But I want you to take something under account. When a patient comes in, we are in the what? Making people feel better business using our what? Our hands, right? And of course our brains. But, when somebody comes in, if you're not assessing, if you're not testing, but importantly, if you're not assessing, right, you're guessing. I want you to take that. When you see all the amount of videos I'm going to make, if you're not assessing, you're guessing. Plain simple. Okay? Now, I'm only going to be talking about the format. I'm not going to be talking about actual orthopedic testing, but trust me, we're going to get to so many, you're going to be like, please stop. Okay? Now, whenever you see the format, it's always going to be like this: name, procedures, positive indications, clinical indications, and why. The name, example, if tomorrow I wake up and I'm like, I want to make an orthopedic test of the knee. How would I name it? I'm going to give it Plaza test. That's my last name. Aaron Plaza, my last name. And I just put Plaza test. So that's the name. The procedure. The procedure is just giving you, we're always going to go on these steps, by the way, 1, 2, 3, and 4. The procedure is basically how the patient and the doctor are going to be, how they're going to be standing or sitting. For example, let's say the patient, is sitting down, facing the wall. You're going to be behind them, or you're going to be to the patient's right, or you're going to be to the patient's left. Okay? And one thing I want you to understand is when we're talking about a patient, the left side is always chief complaint. What does that mean? Let's say a friend comes in, or a patient comes in, and he has left shoulder pain. When we're doing orthopedic testing, remember, you have two shoulders. You don't have one. But if the patient starts with the left side complaint, or it hurts his left side, where do you think we're going to start the test? We're going to start it on the side that is not affected, on the opposite side. But remember, all the tests that we're going to do, I don't want to confuse anybody, so just take under consideration that his affected side is his left side. Of all the orthopedic testing you're going to be seeing, we're going to use our imagination and just know that his left side is hurt for some reason. If it's in the dead center, well, we'll learn how to go through that, okay? But just know that when it's on the left side, we're going to start on the right. That's it. So that's just a procedure, how we're actually going to perform the test. We're going to, where are we going to apply the pressure, where we're going to push. When we talk about the second step, positive indications, that's, for example, when we apply the pressure or the force and it reproduces something. It can reproduce pain, it can reproduce popping or clicking, it can reproduce a snap or just translation, and all that means just like deviation, abnormal deviation. So that's just basically, okay, it's a positive indication. And sooner, or in about a couple of minutes, I'm going to give you a perfect example. The third one, the clinical indications, for example, let's say I push on his shoulder, I perform a procedure, and I push on his shoulder and I hear a snapping or clicking. It can be, clinical indications can be, a tear of the rotator cuff. It can be, a labral tear. It can be a snap of the supraspinatus, infraspinatus, subscapularis, teres mat. That's just the clinical indication. That is it. Again, we're going to give you a perfect example. And why is because, the snapping, because, when you apply force, it's applying pressure to the, let's say to the supraspinatus tendon, and then it causes a snapping and it rubs on the the humerus and blah 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 blah. Just basically kind of giving you a basic explanation of why this is gonna be positive. Okay, so now we're gonna use it. We're gonna see. I'm gonna show you an example so we know what we're talking about. All right. Hey guys, now we're gonna be using use an example, and this is my friend Eric Castillo, and he's a skeleton, obviously, and he's my patient. He walks in my office, and he's presenting some symptoms, and he's telling me, what's wrong with him. And from what he tells me, it gives me an idea of what procedure or what test I will be giving him. And again, the test that I'm going to be using is not an actual test. It's just one that I made up. And it's just so you guys can understand the format that I'm going to be using. So with everything he tells me, he walks in, he sits down, he tells me, hey, I got a headache. And for some reason, whatever I do, I feel tired, I feel fatigued. I think I have a fever. I have chills once in a while, and I have muscle pain. That's what he's telling me, okay? So I'm going to be using a test called Plaza, my last name, Plaza test. And, I start with the procedure. So I tell him to sit down, facing forward. I tell him go ahead and relax your shoulders, look forward, tell him to take off his hat, okay? And I inspect the first test the procedure that I'm going to do. The first one is, check his nose, and I see that it's red, and he has a runny nose. I also get a thermometer. Tell him to open his mouth, or I just use my forearm, and I see that he has an elevated temperature. I tell him to breathe in deep, and he coughs. So again, the procedure was him sitting down, facing forward, and me as a doctor, looking at his nose, thermometer, and tell him to breathe in deep so he can cough. But the the indications were positive because he had a runny nose, his temperature was higher than normal, and he produced a cough with phlegm. Let's just say that. And the clinical indications will be what that I think will be the flu. Okay. See how we're putting everything together? And the why, because it's a virus and, it spreads easily. And he was sitting on with his girlfriend, kissing her. He was with his grandma. And the grandma coughed in his face, and et cetera, et cetera. The virus went inside his, inside his body, and, affected a cell, and then multiplied, blah, 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 blah. Okay, so let's get the rundown. Name, Plaza procedure. Patient sits down, sits forward. He tells me he has headache, fatigue, fever, chills, muscle pain, etc. Positive indications of all the procedures. I looked at the nose. Runny nose, positive. Elevated temperature, positive. Cough while inspiring, positive. Clinical indications, the only thing I can come up with is, what is it? You got it. It's a flu. And the why, because this happened, so now you understand the importance of, why we need to assess, why we need to evaluate a patient to at least come with a educated guess or a good conclusion of why the person is reproducing a certain type of symptoms. Okay, so thank you so much for listening to this, and again, have patience because I'm going to have a whole ton of content for you of orthopedic testing coming up.